Hello and welcome to Level 4 Health and Social Care. This is Unit 404, Reflective Practice, and we're looking at week 4, our last week of the unit, where we're looking at using research. Okay, the objectives for week 4 are looking at 4.1. Discuss how to facilitate the use of research in practice and its benefits. And criteria 4.2, discuss the potential barriers to implementation of research into practice. As I said, these are the last two criteria in the unit 4.404, reflective practice. So what is evidence-based practice? So the classic definition of evidence-based practice is from Dr. David Sackett, and he said it was the conscientious, explicit and judicious use of current best evidence in making decisions about the care of the individual patient. And he suggested that it meant sort of bringing together your individual clinical expertise with some of the best available clinical evidence from current research. So it's the melding of expertise and up-to-date research. And it's developed over time to integrate your research evidence, your clinical expertise, and also, importantly, the patient's individual views and circumstances. And the characteristics of the practice where you work. So it's about sort of being practical and realistic working. So if you're working in care home, it needs to sort of consider the situation of being in the care home as part of the practice. Oops, sorry. So why is it important? It's important because it aims to provide the most effective care, and in that sense it aims to improve patient outcomes. It also attempts to provide an attitude of inquiry in health professionals to get us thinking about, why am I doing things in this way? Is there evidence that can maybe direct me in a different way or come up with something that's more effective? So it's be part for you as a practitioner, it would be part of your reflective development process. So, as health professionals, we should always ensure that our practice is informed by the best available evidence. Another part of EBP is to identify that sort of limited health resources are now used wisely. So, that you've got evidence for why it's worth doing it this way. And that will help when you're looking for more. If you're looking for more funding for a service user who's got some very specific needs, if you've got some evidence, some clinical research to say that, yeah, okay, you're going to do this, it might cost a little bit more, but it's actually going to be more effective, or it's going to work quicker than the process you were going to use before. I mean, that would give you some value in your funding application. So what do we do before EPB, before evidence-based practice? Well, we relied on the advice of more experienced colleagues, and this was often taken at face value, really, So in the classic system, the junior doctor would defer to the consultant, who might have been a consultant for 25 years. Um, and you also, you sort of do that without really questioning. Um, Health professionals also rely on their intuition, what feels right to them, which can be effective, and also what they were taught as students. And if you're a nurse of 30 years standing, you were a student quite a long time ago. So Hopefully, your continuing professional development would have kept you more up to date, but are you actually using what you're reading, or are you just reading it and then not bothering? So experience, can be subject to flaws of bias. And we all know that things quickly become out of date, especially in healthcare, where modern medicine develops at a rapid rate. Relying on older, more knowledgeable colleagues as your sole information source can be tricky, really, because they could have a bias. They choose to do it because their consultant taught them to do it that way. And the information can be actually incorrect now. Things might have changed. That's not to say that that clinical experience is not possible, not important. I mean, it's important that you feed it in because it is part of the evidence-based practice definition, as we saw earlier. However, rather than just relying on that, you do need to find out find out what new research is there and what evidence is to show that this action is actually more valuable than that action. Or, it can be more effective, or it can save time, or it can be more value for money, those sorts of things. So what can we use research to do? We can use it as a foundation for restructuring a service. There may be research done where it's been done elsewhere that can help us see that running your service that way can be more effective. We can use it to inform policy when we do our policy reviews. To address a specific issue. If there's a problem, say within your care home that you just can't work out, maybe find some research, see if something's been done, if someone's resolved that problem elsewhere. It can help you to support a policy stance. So if you're going to write a policy, having some evidence behind you that you can include in the policy, or at least give people a link to reading, makes people understand why you've written the policy. It can assess with service monitoring and review. You can change the standards that you're reviewing against, and it can provide you with quality assurance. If you do it this way, is it going to be better? Is it going to you're going to get better satisfaction for the service users? It can, as I said, I've mentioned justifying funding before. And sometimes it's used at policy level to inform care standards, if CQC need to change standards in any way, or if the government chooses to change standards. And it can also be used for educational training requirements. It could be that after a certain period of time, all people who work in care need to have this qualification or that qualification. Such as at the moment, it's a minimum of the level 3. Those of you who go on to do level 4 and 5, that you will be using evidence-based information that will make you more employable in that respect. But you have to have your level 3 to work in a care home. So, and your level 3 is based on up-to-date information. So barriers. One of the question asks you, what are the barriers to actually using research as part of your practice? And I've got a little chart here, as you can see. The top level of the circle, the top hemisphere, is really about the barriers. The bottom hemisphere of the circle is really about possible facilitators. So for the moment, we'll just sort of we'll have a little focus on the barriers. As you can see, there are 3 circles, one with a black outline, one with a green outline, and one with a brown outline. The black outline is the sort of high level policy. So one can talk about that as we can look at government policy here. And one of the barriers to it being effective or to using research properly is that the policy makers, so in the case of the UK, that would be the MPs and the ministers who are given the role in health, are not trained and not skilled in research methods, so they're not up to date. Now, usually, especially with health, they have specialist advisors who hopefully are. Well, you'd like to hope so, but sometimes there are political reasons why they might not be as up to date as you want them to be. But that can be a barrier. So if someone's actually writing policy, so it could be in central government, it could be in local government, it could be in NHS England. And those policymakers aren't really trained in sort of understanding research methods. They might not make good use of research into their policy. They might be suspicious of some of the findings, or they might politically not be happy about them, so they might omit them. So that can be a barrier. So that there could be some sort of disagreement between research and policy considerations. They want to write a policy in this direction because it suits them politically, but the research doesn't back them up. So that would be a barrier to them using the research, and they'd probably go ahead and write their policy anyway. Within the green circle, this is more at an operational level. So with people who create your day-to-day systems. So it will be like your care home management or owners. And they would be looking really at the day-to-day operations. So they'd be looking at things like time constraints. Maybe the staff don't have enough time to either make themselves familiar with research or to sit down and think of ways they can, change care plans to effect, because, that sort of thing always takes time. They may, if they have a lack of workforce, they just might not have enough staff to cover, let alone do any of this more, as I said, more time-consuming work. They may not be able to access training courses, which sort of helps them understand or be aware of up-to-date research. The academic part of the research might not really gel with how you can practically do things on a day-to-day basis. Remember, most research is done, often in universities. Maybe they don't always, when they come out with an idea of how you can do it better, or it might be done by medics who don't actually have to carry out these roles. So also, it's access to research. They might not know where to go to get it. Or they might find it hard to access, because quite a lot of research has to be accessed by, even if you're accessing online, you may have noticed during some of your study time that some of these you have to access by pay. And if you subscribe to all of these different research sites, you'd be a lot poorer, really. You'd be spending a lot of your money on various different research sites. So it would mean that the organisation would have to pay. They'd have to decide which ones they wanted to pay for, therefore miss some of the research that comes out on other sites. So looking then at within the brown circle, these are about the individual clinicians and individual practitioners. One of the barriers for them for carrying out research-based work is that they don't have the skills to do it. The research might suggest that you do this, this, and this, but they might not have been trained to that level to actually carry out that sort of skill. They may not have the time, they may be very thrashed. As we've said, the team might be short of staff, they may have to cover for each other. Or they're just, a very busy care home. And it's quite hard to sit down and sort of go through all of your care plans, finding bits of research that can help improve your care plan. You need to be given that time to do it within your working day. And because of that, they might not have motivation, because they've just set their care plan and now they want to get on with their job. And now someone's saying, well, I want you to review your care plan every now and then to look at up-to-date research. And they might think, oh my gosh, that's more written work for me to do, more written work that takes me away from the patients or the clients. So some people might not have the motivation to do that and say, yeah, I'm happy with my care plan, I want to stick with it. So they're not engaged in the research because very often you are not engaged in this research unless you've been asked to be a sort of pilot study where you can be part of it. And we've often found that when specific care homes become part of a pilot for a piece of research, that they actually engage with the research a lot more, because they can see it and they understand what they're doing and they become part of it, and then they can keep using it when the researcher walks away. And for some people, they have their inability to interpret research findings. Now, again, I know quite a few of you have looked at some of the research bits I give you to have a look at, and the way they're written is very, very academic, or can also be quite scientific if you're looking at health research, and is not always easy for people who maybe don't have that degree level education to able to interpret some of the findings, or if you do, it takes you a long time and it's quite a struggle. So quite a lot of the people in care said that that was one of the issues. In fact, I looked at a piece of research myself, looking at UK nurses. I put a little text box at the bottom here, and the two main barriers that they identified wasn't just about time. They did mention, time, busy day, and all that. But one of the things they mentioned was inaccessibility of the research reports, not really, tons and tons of work in it, and not making it quite difficult for them to pick out the bits that were useful, the conclusions. And the other one they said was a lack of authority to make the changes. So I found a piece of research. It says I should do things this way, but I don't have the authority to make the change, even though I might be the key worker for Mrs. Jones. So who do I have to go through? I have to go through my supervisor and then my manager, the team leader, and then do we have to have a team meeting and that? So it doesn't allow them just to make changes on the run when they're doing their care plans, really. So that needs to be thought of as well. Who do they have to go through? How simple is it? If it takes them 3 weeks to get an agreement to make a change, they might have moved on to something else by then. So those are some of the barriers that have been identified about using and implementing research into your day-to-day practice. We're now going to look at some of the measures that are suggested um, to see how we can manage this. Okay, so having a look at some of the measures that we can do to help implement, really, or facilitate the use of research. One of the things is ensuring access to research. So there's been a lot of initiatives undertaken to ensure that practitioners can have better practical access. And this includes some enhanced library services, information alerting systems, so basically getting notifications, often now on your phone or your laptop or your tablet. Um, a lot more things are being put on the internet with easy access to it. Lots of research databases. As I said, there is a little bit issue for some that you still have to pay subscriptions, but there is a lot more available. Also, there's a number of social care research centres, usually based at university. I've mentioned the Social Policy Research Unit at the University of York. Quite a few other universities have social policy research units, and you can go and see them. And if you're a practitioner in the local area, you're often able to join their library as well. So you can just go along, and you need to make an application, but they'll often let you do that. Other sort of facilities, the Department of Health, Centre for Evidence-Based Social Services, these have all got websites. Ski, we use a lot here. You'll see ski videos, you probably noticed ski. Um, And there are some local research information officers. They may be linked to your local health services. They may be linked in the office area, but you can sort of usually go on your local, in our case, it's the NHS website for your local town, and you can find out who they are and you can talk to them. And if you're a care home in the locality, they'll they can give you access to some things, or you can get specific permissions as well. But joining on following different organizations, say, if you're working with older people, the Alzheimer's Society, Age Concern, and that, and using their notification process is usually the best way. Then you'll get notifications to new pieces of research, and you can decide whether to follow them up. In the UK, the NHS has lots of areas you can join onto and get notifications as well. So if you're particularly interested in a certain type of care delivery, such stroke care or something like that, there's a lot of stroke planning groups and stroke research groups that you can, if you just sort of Google for them, then you can join their notifications, and that will tell you when something new is going on. And you'll need the notifications just to keep you up to date with new research, and then you can go in and have a look at it. So I guess for the average practitioner, the use of the internet really has been the biggest access to research. Making research comprehensible. Now, we know that we've already discussed that it can be very academic, it can be very difficult. And one of the things that's being promoted again by NHS England, particularly, is to make it more easily understood. And they actually started doing this by really aiming at, carers and service users and carers and family members. But that's actually been quite useful for some practitioners as well. So they are often creating user-friendly formats, and they are often taking summaries and key messages. So if you sort of see a piece of research someone, you can actually Google around to find a summary on or key messages for, and you'll often find some sort of summary sheet which can really help you. And then if there's something else, if something you're particularly interested, you can maybe delve into the detail. There's also more training courses available for sort of working with this. And there are some initiatives to help you interpret research. So you can do some training courses in critical appraisal skills training, and some organizations have research discussion groups where they get together, sort of like a mini team meeting. And or I used to call it, well, we used to call it journal club when I worked in a multidisciplinary team, and we would bring something interesting, like maybe once a month we'd have journal club where we'd bring an article or a new piece of research that we thought would interest the whole team, and we would sort of discuss it and think about how can we make use of it. You can also contact the university. Very often, most of this research was done out from universities, and you can often contact the university, and they're generally willing to offer some advice and expertise as well about how to use their research or about what they were aiming for. So don't think that they don't want to talk to you. They're usually very proud of their research. They're usually quite happy to talk to anybody about it. Another way of facilitating using research is by developing best practice models. And this is like, as I said, offering your care home up to be a pilot or a demonstration project. And that's often by following, usually people follow particular researchers. So, say if I'm based in Bournemouth, we've got University of Bournemouth has a big health and social care team. So if I was working in a care home in Bournemouth, I'd probably link with them and follow a lot of the work they do and sort of make sure that they have our names so that we might be, they might come to us if we're interested in being a pilot or a demonstration project. And as I said, when I've worked with staff who have been demonstration projects, they found it quite exciting to be part of something like that. And they've been quite committed to the outcome of that piece of research. And it wasn't that hard to get staff to implement it because they feel it's almost like their piece of research. So it's, they want it to do well. Another way of facilitating research is by developing a culture that supports research use. And that is about making a bit of time for it as well, but also from senior management taking a bit of leadership, identifying that they want research, so in their mission statement, in their policy and objectives, if they use research in their policy creation, it will sort of filter down to the care staff as well. Um, and it's really about, having something that's constantly being reflected in up to date research. So that if the responsibility is taken at the high level, then it will encourage the individual teams to do something very similar. And also, quite a lot of organisations have done some things where they've identified research champions. So it might be that's been quite effective. I've seen that happen in some NHS teams, hospital teams, where there are some people who have particular interest in a certain type of research, and they're the research champion for it. So, say you might be someone who's particular interest in dementia or particular interest in Lewy body, and they might be sort of, be willing to follow and keep up to date with the research, and then bring it back to the team and involve the team in sort of using it. So someone who's willing to give up the time because they're actually interested in something. And you will find people like this. So again, as another way of facilitating something that's developed of the late is there are 3 models of research use as well. And again, depending on what your organization feels is appropriate, these are 3 different ways that you could take the organization or the care home to make use of research. So the first model is the research-based practitioner. And this is actually giving the responsibility to the individual practitioner to say to yourselves to keep abreast of research and ensure that it's used in day-to-day practice. This use of research is a linear process, so they access it, they assess it and think, yeah, is it good, is it useful, and then they apply it, and they basically show others in the team sort of how to apply it and bring that information. The practitioners need to have high levels of professional autonomy to change practice based on research, so they've got to have the agreement from that they don't have to go and get it signed off by management, that whenever they come up with some new research, they'll just naturally bring it into their practice. Not all organizations are comfortable doing that, I have to say, but for those who do, it can be effective. So, but the key to it is them taking the responsibility, and they have to find the best practice things for the service users and then sitting down and getting the service users' views and implementing everything. So the knowledge is applied. It's like recent research in combination with the practitioner's own skills and knowledge and the service users' knowledge, thoughts and feelings. Out of that, you create a particular decision and then you affect the care plan. So the role of the service user is sort of the end stage of the process, really, because the practitioner has to do all the gathering and then has to apply their skill knowledge to say, well, can I make this change? There's no point taking it to their views. There's no point taking it to the service user if you know you physically can't be done in your care home, you don't have the equipment, or people don't have the training and that. So the service user are not really in at the beginning. They tend to be there at the end to sort of, give their say, or say, well, I don't really want that to happen to me. Okay. There are some of the difficulties about being a research-based practitioner is, it really, really depends on how skilled the practitioners are, how new to the job they are, how many years of experience they've got. Very good for a very, very experienced team, when you can take them to that level. Not so good if you've got a new team that hasn't bonded, and you've got people who are very newly experienced, or having just done their level 3 or something like that, because they don't have the skills yet to be able to assess the research and say this is good, this is not. You need to be at quite a good level. Most of the people who work as research-based practitioners are usually people who have a professional qualification, like nurses, OTs, physios, usually at degree level, because they've learned to be able to assess research, and that's quite a skill, really. It's not something you often see average care workers being able to be a research-based practitioner without doing a lot of extra specialist training. Second model is the embedded research model. And this is used by actually embedding the research in the systems and processes. So this is really something that's more, as I said earlier, in the hands of management, so that everything you do, there is research in it. So the standards that you set for the care home, the policies and procedures, the types of tools that you use, what's the research on them? Is it the best one? Can you get a better one? And this really lies with the policymakers and service delivery managers. So it would be your care home manager and anybody else who makes policy in that area. And it sort of follows through. So it relates directly. So if a policy changes due to research, then the practice will change as a result of the policy changing. So in this sense, the practitioners are not there to engage directly with the findings from research. It's your policymakers who will change your policies and procedures. Or CQC might change their inspection framework as a result of new research. And therefore, your managers will have to sort of create, they may have to change procedures to relate to CQC. So the link isn't between research and practice, but it's actually between research and policy. So in this case, the embedded research model does not require high levels of practice autonomy like the previous one did. So they also don't need care workers trained to a very, very high level, because basically you just need to follow the policy that's being reviewed from you. But those who are creating the policy would need that extra training and those extra knowledge and skills, really. And the sort of adoption that you might encourage, you might have some performance measurement, you might have inspection, it might be included as part of people's appraisal, sort of how are they working with the new change of policy. That's quite normal. That's the embedded research model. And the last one is the organizational excellence model. And this again it rests with the social care delivery organizations, and again it's sort of in the hands of the leadership management of the organization, and it's used by really your manager, your leadership, developing a culture that's very research minded, picking up local research findings that are quite interesting, doing some ongoing learning for all individuals as part of their professional development. So saying that any changes we make, we've got to do it with a bit of, based on a bit of research. And these are the sort of people who often, as I said, want to be pilot studies. They create partnerships, often with local universities, because that's where most of the research happens, or maybe NHS England for us here. There is research. And they want to be sort of part of the research too. So they're a researching organisation in that sense. So they're often offering themselves up to be involved. So here, the development rises not again, not with the practitioners, not with the policymakers, but with the leadership and management of the organisation to say, this is our style, this is our way. So that people who join there know that they will be expected to sort of looking at their role in a wider way. They'll be expected to be reading and, they may even have some, as I said, they may have research champions who might be involved. So the local management will probably have very specific job descriptions, or it will be included in your job description. It's your responsibility to find out about local research, bring it back to the organisation, discuss it. As I said, there could be reward systems for people who found interesting pieces of research that you can make use of. Training will all be research based, and also your management practices. You need to identify sort of what research it is. Why do you do it? What research is it based on? So they would probably have all that documented somewhere. So again, it's a cultural approach, and it's about integrating with the wider world. So having some sort of connection with some research facilities, really, so that you will be getting the information very, very directly. The role of the service users is a bit less clear, really, but there is potential for them to be involved in, certainly if you become a pilot care home, say, for a piece of research, and obviously the service users can be active partners in that. So in a sense, they're not just getting the end result, but they're part of the piece of research as well. And again, I have experience of that, and some of them have really, really enjoyed, even when things haven't gone quite right, that they've seen the values in it. You can get involved as a practitioner who testing out research findings. So you might find the local university has done a piece has done a piece of research in a certain area about managing mouth care, say for instance, and they might call around for a local care home to sort of test out their ideas, or maybe using a new tool to do it, and you can be willing to do that and test out their research finding. So that's a sort of cultural approach. We are a research friendly care home. We want to be part of it. There is some extra reading for you. I've put some research papers, of course, on barriers to implementing research. Two useful papers that I'd like you, skim over, maybe have a look, see how you feel about reading a sort of classic research paper. It's fairly academic, but you should be able to at least, you might want to look at all the detail in the literature reviews and that, but maybe just have a look at, what the results are really. Have a look at the introduction and the results, if nothing else. Okay, so that's really all there is for 4.1 and 4.2. Okay, hopefully you should be able to find enough about research over that. Now I'm just going to quickly talk through the assignment for you. Okay, so task 1 is 500 words, and you're focusing on reflection. Okay, so 1.1, you need to identify 2 models of reflection commonly used in health and social care practice. Now, I gave you some information on several models. So I want you to choose 2 out of the models that I gave you in week 1. Okay. Just identify those 2 models and give me a summary explanation of those 2 models, because you can see here clearly it asks you to identify and explain. Okay. So don't just give me 2 names, but give me a little summary explanation of the 2 models. Okay. You don't have to compare them. There's been no question asking you to compare the 2. So it's just a sort of clear descriptive paragraph. Okay. 1.2, explain the benefits of reflective practice. So again, go back to the slides for week 1, where we tell you what are the benefits of reflective practice? Why is it a useful tool? Okay. So just explain to me what the benefits are. Again, summarize, paraphrase. Don't forget to put some citations in there. Okay. You may need to go out and find some, but that's fine. So with the 2 models of reflection, I need a citation for each model, and maybe for benefits, at least 1 citation there. Okay. 500 words, break it up as you wish. Okay. Task 2 is a bit more complicated. This is your personal development plan. Okay. Now, you're not going to have time to do a very detailed personal development plan. So we're going to assume it's an early plan that you've just started. Okay. So I only need to see a couple of objectives, 1 or 2 objectives. Okay. If we have a look at the assessment criteria, 2.1 is demonstrate an understanding of the use of personal development plans. You don't have to write anything here, because when you create your plan, I will pick up the answer to that. Have you demonstrated an understanding? That will be my decision. Okay. So you don't have to write anything. Just by creating your plan, you'll show me whether you've understood it or not. 2.2, you do need to write a paragraph on. Discuss how personal development plans are used in health and social care practice. And we looked at personal development plans in week 3. Okay, so just have a look, go back to the slides in week 3, and let me know how they're used in health and social care practice. It's just to discuss, so you just need to explain it to me. 2.3 is explain the role of clinical supervision in health and social care. We looked at clinical supervision in week 2. So if you can go back to week 2 and just give me a brief summary of the role. You cannot write a lot there, because you are going to have to put your personal development plan in this too. Okay, so you just need a paragraph. What is the role of clinical supervision? What does it do? What is it for? So don't get it to take you off at tangents. It's not asking you how you do it. It's not asking you what is the process. It's just what is the role? What does it do? Okay. So try to give me an idea of that. What is the purpose of it? What do you have to do? You might want to say that, there are 2 people involved, the supervisor and the supervisee, and everything is written. But you don't need to spend too much time on that. 3.1 is develop a personal development plan. Now, if you go back to week 3, you see I gave you some templates to use and an example of that template being used. You can use that template if you want, or if you found another one that you like more, that's fine. That's fine. If not, you can use mine. I have no problem with it. The most important thing is, if you look at 3.2, you have to at least include what is the aim of your plan, or what are your objectives. Okay, an objective is your aim. How are you going to achieve this objective? What will the success criteria be? So what will it look like? You know, you would have passed your level 3, or you would have read that book, you would have shadowed that team leader, whatever. Okay. And how will you monitor if it's achieved? So you could say, like, I will review it in a month and I will check back to see if I've actually had that shadowing session. You know, you need to write it out. The plan needs to cover the little bits above here. So it needs to establish your purpose or direction, identify your development needs, identify your learning opportunities, formulate an action plan, undertake the development, record the outcome, evaluate the review. So what you could do is you could do one objective that you think you've already completed. Now, you might have something that you're already doing in your work placement that you've completed. It's worth doing at least one objective that you've completed, because then you will follow it or fill in all the boxes, and you will show me what your success criteria is. And then you can write me another objective that you've only just started or you're in the process of. So give me at least 2 objectives. Okay. One that's preferably happened, that you've come to the end of, and one that you might be in the process of or nearly finished or whatever. So if you're a bit unsure of what objective that you could put in that you might have already done, you could put in achieve your level 3, and you could just reflect back on your last course and say that you've done your level 3. But don't forget, it needs to have an objective. It needs to be a success. Success criteria is completing and passing my level 3, monitoring it. I finished it. I got all my assignments marked, and I have my certificate. Yeah, review at the end of the course or something like that. Okay. If you are unsure about any element about your PDP, don't forget you can contact me on WhatsApp, or send me an email if you prefer. Okay. Now this whole task 2 is 900 words. You can put your plan, you can cut and paste your plan into the document, or you can have it as a separate. If you're doing your plan as using the template, you can have it as a separate sheet, because you can upload more than one file, remember. But you need to count the words in your plan and add it as part of the 900 words here. So you're going to have your plan, and you're going to have a paragraph of writing for 2.2 and a paragraph of writing for 2.3. Okay. And the rest of it I will gather 2.1, 3.1, 3.2. I will gather that information from looking at your plan. Okay. As I said, anybody who's unsure, come back to me about it. You know where to get me. Finally, task 3, 600 words. Okay. Really focusing on what we've done this week. This set of slides, week 4 slides, discuss how to facilitate the use of research in practice. And picking up from that, you want to pick up what are the benefits and what are the potential barriers. So 4.1, discuss how to facilitate the use of research. Give me a little bit of information on what the benefits are, and give me a little bit of information from the things we've discussed today as to things that you could do to facilitate and implement research into practice. So we've got the 3 models there, or we've got the approaches before, the overview, the practitioner, the excellence model, those sorts of things. You need to work it out. You've only got 600 words. 4.2, discuss the potential barriers. So don't forget to go back to my few slides about barriers. You've got a couple of pieces of research you could cite for barriers. And if you go back, there's a graphic on barriers where I've put I put a reference underneath, and you can have a look. You can use that as a reference as well for the stuff about barriers. Citations, how to use, facilitate the use of research. If you write, say, about the excellence, or if you write about the embedded research model, then you just need to create a citation, and you'll be able to find one from Google. It wouldn't be that hard. Okay. So I want to see a citation for barriers and a citation for the use of research. Okay. Going back to task 2, I also want to see a citation for the supervision stuff as well. Okay. So a citation for at least one citation for every criteria. Okay. Again, any questions, you know where I am, WhatsApp or email, not a problem at all. Just contact me at anything you're not sure of, and good luck. And for you, this is the final unit, I think, for your for your level 4 course. So good luck, and I will be marking your work for the rest of the units. Okay. Okay, so I will see you again. Maybe, maybe not. Okay.